So welcome back, guys. Today in this session we will be talking about the international health, right? So we are having several bodies even outside the India who are actually working for the betterment of the people, for the betterment of the health of the communities, right? And they are talking about the health in various cities, various countries, right? So today we are going to talk about those organizations. One of them organization is very popular, that is WHO, World Health Organization, and there are various rules and regulations which we are following as well as far as WHO is concerned, and whatever programs are coming, whatever regulations are coming from Government of India side, and all of those things are actually compared with the WHO rules and regulations as well, right? For example, I told you about the ANC visits. There were 4 ANC visits which are actually recommended by the minimum 4 ANC visits are recommended by the Government of India, and at the same time I told you that WHO recommends the 8 visits minimum, right? So that is the thing. That's why there are several other kinds of parameters as well which we are comparing with the WHO data, right? So today let's talk about the different agencies, right? We need to know about some important points about them, right? So international health agencies, right? We are having this n number of international agencies are present over here. For an example, there is WHO, World Health Organization. You know that, everybody knows that, right? That is a bigger one. Then UNFPA can be there, UNDP can be there, World Bank, FAO, UNICE, Danida, European Commission, Red Cross, USAID, and UNESCO, Colombo Plan, ILO Care, and several others are present over there, right? I will be talking about some of them, right, in this particular session. So beginning with the WHO, guys. WHO, we know that it is the World Health Organization, and this is the symbol which you need to remember. Even you are looking at various places, newspapers, and you are looking at in the televisions and other places, right? So this is the World Health Organization WHO symbol which you need to remember, and basically it is the agency which is actually the part of the UN, right? This is a specialized agency of the UN, specialized agency of the UN that acts as a coordinating authority on the international public health, right? So whatever thing is happening in the world, the WHO, as far as disease are concerned, as far as health is concerned, WHO is having a bigger view on that particular thing. If some disease is becoming endemic, if some disease is becoming pandemic or epidemic, for example, in the COVID cases, we know that it was rapidly progressing. First of all, they have called it off as epidemic, then they called it as pandemic as well. So WHO is there, which is actually governing all these kind of things and keeping their eye on the particular diseases, or if some countries particularly free of that disease, they will try to make sure that the particular disease should not enter into that particular country, right? So this is the thing over here. So it was established on the 7th of April 1948, and its headquarters are present in the Geneva, that is in Switzerland. Various headquarters, we will be seeing that international health agencies are concerned. Various headquarters are present in the Geneva, Switzerland, right? Okay, so what are the WHO functions? What are the work of WHO, right? So it is having several works, right? It's a bigger body. So prevention and control of the specific diseases, right? The development of the comprehensive services, family health, biomedical research, health services, various kind of health services are there, environmental health, health literature and the information, cooperation with the other organization, right? So by cooperating with other organization, they might be launching their new programs and all of those things, right? If you talk about the regional offices, in some countries they are having their official regional offices as well, right? And as far as Southeast Asia is concerned, in the Southeast Asia, the WHO center is present in the New Delhi, right? So in the Southeast Asia, first of all, that might be the question, guys. Southeast Asia, New Delhi is the region where New Delhi is the city where the WHO headquarters are located. I mean the WHO regional office. Headquarters are present in Geneva, Switzerland, but some head offices are present in several countries. One of them is India as well. That is the WHO CRO is present over there. Then you can see several others in the Africa, Hazare, Zimbabwe, WHO Afro is present over there. In the America, Washington DC, USA, WHO AMRO is present over there. Europe, Copenhagen, that is in the Denmark. WHO Europe is present over there for the Europe, right? Now Western Pacific, Manila, that is in Philippines. WHO Wipro is present over there, WPRO, and WHO regional office for the Eastern Mediterranean, that is the WHO EMRO, right? So these are some regional offices which are located in different cities, different countries, as far as WHO regional offices are concerned, right? Over here, initially WHO has been formed later on in the 1948 year, but before that, what was happening? Let's talk about that as well. So in the very beginning, I'm talking about the year 1902, right? There was Pan-American, right? There was Pan-American Sanitary Bureau. There was Pan-American Sanitary Bureau, right? And this was the first organization, right? This was the first organization, right? This was the first organization, guys, right? Then after that, what happened? In the year 1923, right? In the year 1923, one more organization formed. That was Health Organization of, I'm just writing ORG, Health Organization of League of Nations, right? Health Organization of League of Nations, right? And after that, finally, in the year 1948, World Health Organization formed. That is WHO, that is the World Health Organization, right? Okay, guys, and that was formed on which date? In case if they are asking, that is the 7th of April. Okay, 7th of April, that was this WHO body formed, right? Okay. Now, we shall be talking about the next one, that is the UNICEF. Again, very, very important. You must have studied about this at several places. UNICEF, this is the symbol of UNICEF, which you need to remember, right? This is the symbol of UNICEF over here, right? So UNICEF, what is the UNICEF basically? Guys, the UNICEF is the United Nation. UNICEF is the United Nation International Children Emergency Fund. So sometimes they try to confuse you with the full form as well. They will be giving you the several options, 4 options, and you need to choose among one. So it is International Children Emergency Fund. Emergency Fund. So you should know that. Okay, because in the exam, all the 4 options will be sound alike, look alike. So at that point of time, you need to understand. Basically, they will try to confuse you in between these terms, children and emergency, right? So United Nations International Children Emergency Fund. Okay, so please remember that as well. So they are basically talking about the maternal and the child health, MCH. They are talking about the maternal and the child health, MCH. They are talking about the child nutrition, because they are talking about Children Emergency Fund, child nutrition, family and child welfare, and education. They are talking about one more scheme, that is a Gavi FFF campaign, right? So this is a symbol of UNICEF. Please don't forget this. Now UNICEF was formed in the 1946. WHO was in 1948. UNICEF is before that only, 1946, right? Now these are the specialized agency of the UN. Again, guys, WHO was also the part of UN. Headquarters in the New York this time. Headquarters are present in the New York, and headquarters of WHO is present in Geneva, that is in Switzerland. Now it was established in 1946 to rehabilitate the children. Very important point over here. It is working in collaboration with several other international agencies, for example, FAO, UNDP, WHO, and UNESCO, and others, right? I told you the WHO is also sometimes cooperating with other international agencies for the betterment of the health of the people, right? So it is providing the assistance in various fields of maternal and child health and environmental sanitations, right? So very, very important points about the UNICEF, which you need to remember. Next one is the Food and Agriculture Organization. Next one is the Food and Agriculture Organization, that is the FAO, and that was formed in 1945, right? So WHO in 1948, UNICEF is in 1946, and now I am telling you about the FAO, that is the Food and Agriculture Organization, and this is in what year? This is in 1945. So here they are talking about that Food and Agriculture Organization, FAO, was formed in the 1945. This is the logo which you need to remember about the FAO, right? This is the logo for the FAO over here, right? Headquarters are present where? Headquarters are in the Rome. For WHO, Geneva. For UNICEF, New York. And for the FAO, I'm telling you, Food and Agriculture Organization in the Rome, right? And Rome, yeah, where there is Italy. Eliminate the hunger, right? They wanted to eliminate the hunger here. They want to make sure that everyone is getting the proper food over there. About the food insecurity, malnutrition, they are talking about that. So make agriculture, forestry and fisheries more productive over here, right? Because as the name suggests, Food and Agriculture Organization, so it is related to food only. They want to eradicate the malnutrition. They want to talk about the eliminating the hunger, food insecurity and all. They are talking about these kind of stuffs over there, right? Next we shall be talking about, that is the ILO, right? That is what? That is the ILO. This is the International Labour Organization, right? ILO is what? That is the International Labour Organization. This is the UN agency again. This is the UN agency, which is actually dealing with what? this is dealing with labor issues, as the name suggests, international labor organization. So it is dealing with the labor issues. It is related to the international labor standards about their rights and all, social protection and the work opportunities for everyone, right? And this is the symbol for the International Labor Organization, which you need to remember. This is the symbol of our INO, that is the International Labor Organization. It protects the rights of the laborers, right? Okay, so ILO organizes the International Labor Conference in the Geneva every year. In what month? That is in which month? That is the June, where conventions and recommendations are crafted and adopted. So every year in the June month, right? In the June every year, in the Geneva, they are actually organizing the International Labor Conference, right? So every year in the June, in the month of June, ILO is actually organizing the International Labor Conference for the betterment, and recommendation are crafted and adopted for the betterment of the labor over there, right? The next one which we shall talk about over here, that is the USED, right? That is the USED, right? What is the full form of USED over here? USED is for United States Agency for International Development. Okay, so what is the full form of USED, guys? International Development. So United States Agency for International Development. Please remember the logo as well. This is the logo for the USAID over here. You can see that United States Agency for International Development. This is the logo for the USAID over here. Some salient features of the USEF I would like to mention, that it helps in controlling the communicable diseases, guys. It helps in controlling communicable diseases. For an example, what communicable diseases? Like malaria, right? Like TB and all, like diseases, right? For an example, malaria, they are running the malaria and the TB nutrition program, malaria program, TB nutrition program, okay, and all of these things they are talking about. So for the prevention of the communicable diseases, right? They also helps to improve water sanitation, helps to improve water supply, food supply, right? Proper sanitation measures, right? Proper sanitation measures and all of those things, okay? So that is about the USAID, United States Agency for International Development, right? Sanitation measures, okay? So that is about the United States Agency for International Development, USAID. Next one is the International Red Cross. Yes, not very hard over here. International Red Cross. It was established in 1863. That is quite old. Headquarters are again present in Geneva, Switzerland, where the WHO headquarters are there. Every year in the Geneva International Labour Organization, in the month of June, they are organizing the meeting over there, organize the conference, right? Okay, I have told you about that as well in the ILO. Now here they are actually helping the wounded people, war or wounded people, prisoners, refugees, civilians, and mainly the people who are wounded in the war situations, and in the war fields and all, they are actually providing the first aid to them. So that is about the International Red Cross. This is the logo for the International Red Cross, right? Okay, now we shall be talking about the next one, that is the non-governmental agencies. Non-governmental agency, that is your Rockefeller Foundation. This is the logo for the Rockefeller Foundation, as you can see over here. This is the logo for the Rockefeller Foundation. Here they are talking about the controlling of hookworm. Over here, and they have also established the All India Institute of Hygiene and the Public Health, right? All India Institute of Hygiene and the Public Health, right? Here one more thing, guys, where are the headquarters of the Rockefeller Foundation? That is in the New York, right? And New York is in USA, obviously, right? So that is in the New York, right? Okay, now it also works for the upliftment of rural areas, right? It also works for better rural areas, betterment of rural areas, right? Okay, so that is about this thing, right? Otherwise it is helping in capacity building, field demonstration areas, grant in aid for the medical colleges, and which you need to remember, please don't forget, All India Institute of Hygiene and Public Health, okay? That might be appearing in your MCQ. Cooperative for the assistance and relief everywhere. So that is the CARE, right? CARE, this is the logo for the CARE, right? This is the CARE. That is the Cooperative for Assistance and the Relief Everywhere. Here it was established in 1945. Again, the headquarters are in the Geneva, Switzerland, right? It is the humanitarian aid organization, this is right, and here they are focusing on fighting with the global poverty, right? Next one is the very famous businessman, respectable, that is Bill Gates and Melinda Gates Foundation, right? That is the Bill Gates and Melinda Gates Foundation. Some salient features about the Bill Gates and the Melinda Gates Foundation. Let's talk about them as well. So that is the BMG Foundation, right? There is a BMG Foundation. Obviously, it is not the governmental one. It is the non-governmental organization over here. So some salient feature about that, right? So here about the about the Bill Gates Foundation, if you talk about, it is working for diseases like tuberculosis and HIV. It is working for diseases like tuberculosis and HIV, right? It also promotes the Japanese encephalitis vaccinations in the endemic areas where the Japanese encephalitis is more. So promotes Japanese encephalitis vaccine in endemic areas. Okay, right? Because comparatively Japanese encephalitis vaccines are comparatively expensive, right? Okay, then here one more organization is coming under them, that is the GAVI, right? What is GAVI? GAVI is basically Global Alliance for Vaccine and Immunization. Global Alliance for Vaccine and Immunization. Okay, so that is the GAVI, also coming under this Bill Gates and Melinda Gates Foundation. Please remember that they were working for the disease like TB and HIV, right? So next point over here which we shall talk about, that is the next foundation, that is the SIDA, right? That is the SIDA Foundation. SIDA Foundation is also called as the, right, that is also called as the Swedish International Development Cooperation Agency, right? So this is the Swedish one, and here we are talking about funding of the RNTCP. So it is basically the program which is funding the RNTCP, right? So basically you need to remember this, right? Then we shall be talking about the next one, that is your DANIDA, right? So that is your, this was SIDA and this is the logo for the SIDA, right? And now we shall be talking about the DANIDA, right? DANIDA basically, this is a symbol for the DANIDA, right? This is a symbol for the DANIDA, right? So DANIDA basically, this is the Danish International Agency, Danish International Development Corporation, Danish International Development Corporation, right? And here what they did is that they initiated the national program for the control of blindness in India, right? They initiated National Program for Control of Blindness, NPCB. They initiated NPCB, National Program for Controlling Blindness in India. So that's why it became very important. DANIDA, what is the work of DANIDA? This is very, very important, high yield guys. This might be your MCQ. That initiated, who initiated the NPCB program, that is a National Program for Control Blindness, that was your DANIDA, right? Here one more agency I would like to mention over here, that is the 12th one, or I would say okay, whatever it is, whatever number it is, you can count. This is the UNDP, right? UNDP is the United Nations Development Program, United Nations Development Program. Okay, please look at the symbols also guys, because in sometimes they are asking us the symbols, right? So at that point of time, if you don't know the symbol, if you don't remember the symbol, then obviously you might be in trouble over there, right? So in the UNDP, what we shall be talking about over here, this was formulated in the 1966 year, which you need to remember, and their headquarters or their offices are present, their office is actually present in the New York. Office is present in the New York, which is obviously in United States of America, right? Okay guys, it is also associated with, this is the sign of AW, this is the sign of A associated with, right? It is also associated with the efficient, right? It is also associated with the efficient utilization of manpower, right? Efficient utilization of manpower and human and natural resources, right? Manpower and human and natural resources, right? And look at the symbol of the UNDP, right? This is the logo for the UNDP over here, which is the United Nations Development Program, right? It is like this. Do not confuse this with the WHO's logo over here. In the WHO, there is a snake kind of thing on a bar, right? But here it is not present over here. So this is the symbol of UNDP, right? Okay. Now let's talk about the World Bank. This is the symbol of or logo of the World Bank over here. Basically, World Bank, it actually talks about the improvement in the living standard of population. So if we talk about if you talk about the World Bank, right? It is not giving some kind of money to the world. It is not like that. Actually, it talks about, World Bank. If you talk about, then it improves living standards of population, or community, right? Population in some country, for an example, right? Then it is the UN agency, guys. It is the United Nations agency which is promoting the peace. It is known for promoting the peace. Okay, so that might be your MCQ, guys, because generally it is the talk of a town very frequently in the news media. So that is who is actually talking about the peace, promoting the peace. That is the World Bank. Okay, fine. Now we shall be talking about the bioterrorism agents. Right? So in the bioterrorism agents, guys, we are having three categories, right? We are having three categories. One is category A, then category B, and then category C, right? There are some diseases which might be there in the category A, some might be there in the category B, and some in the category C. So if you talk about the category A, guys, they are talking about the highest risk to the national security. Because they can be easily disseminated or transmitted from person to person. For example, you can take the example of COVID-19, right? This was easily getting transmitted from one person to the another, from one state to the another state, from one country to the another country, isn't it? And we saw that. So it was resulting in the high mortality rates, right? So it was having the potential, it is actually having the potential to cause public panic and social disruption, and that was a condition which happened in the COVID time as well, right? Requires special preparedness actions over there. And we saw that COVID-19 leads to failure of the healthcare system in several countries, right? That is the thing. Now, coming to the category B. So that is the second highest risk because they are moderately easy to disseminate, but it's not that they are very easy to disseminate or they are very easy to treat. It's not like that. It's just that on the priority basis it is coming second. So it is resulting in the low mortality rate comparatively as compared to the category A, and it requires the enhancement of diagnostic and the surveillance capability so that we can diagnose the disease better, right? Now next one we shall be talking about, that is the C category, that is emerging pathogens, and that could be engineered for the mass dissemination, right? For an example, some terrorists are actually planning to attack the people, but this time they are not attacking the people by the bombs and by the some terrorist activity. This is all the terrorist activity only, but here they want to use some like biological agent. For example, if they will be releasing some kind of microorganism in some environment, so by that they might be killing some person by the help of that particular disease, right? Earlier, initially, right, there were many hypotheses going on around the world that it is the hypocrisy of China and it is a plan of China that was spreading the COVID-19, right? But yes, obviously nobody could prove that, and nobody is having the proof. So without proof, you can't say anything, right? So that is the thing over here. So engineered pathogen that could be engineered for mass dissemination because they are available, are easily produced and disseminated, but they have potential for high mortality rate, and that is very important point over here. In the category C people, we are talking about the high mortality rate. Yes, they are coming in the C category, but it doesn't mean that they are not causing the mortality. In the category also, I told you that they are causing the high mortality rate. In the category C also, they are causing the high mortality rate. In the category B, I told you that there was low mortality rate, right? If you talk about the morbidity, yes, morbidity is comparatively lesser over here. But if you talk about morbidity, another one, here also morbidity is comparatively lesser, right? But in the category A, obviously morbidity or the sickness will be very, very high in this case. Okay, so that is the thing over here, right? Here are some examples of the diseases which can be included over here. For example, anthrax, botulism, plague, smallpox, question has been asked. Tularemia and viral hemorrhagic fevers are coming in the category A, right? Because once they are there, it is very difficult to restrict them in one region. Then West Nile virus, calcivirus, hepatitis A, recent toxin, salmonella and all, they are actually present in the category B, and influenza, SARS, multi-drug resistant, MDR, TB, yellow fever, tick-borne hemorrhagic fever, they are coming in the category C over here, right? Now we shall be talking about some international travel regulations, right? Because we are talking about the international agencies, so let's talk about this topic over here itself. So international travel agencies, right? International travel regulations, basically. International travel regulations, right? Okay. Now here basically I'm considering about the diseases, or let's say let's take one example over here. Let's say what about the pregnant woman, right? Can you allow the pregnant woman? Can you allow the term pregnancy? Can you allow the 37 weeks pregnant woman in the flight? Obviously not, because who wants that particular thing? Whatever airline is there, right? Who wants the headache that delivering the baby inside the plane, right? There is no fun in delivering the baby inside the plane, right? If there is an emergency, that's a different thing. So that's why they made the criteria, right? They made the criteria, and government made the criteria that for the pregnant women, domestic airlines, right? They are actually, most of the domestic airlines I'm talking about, they are allowing the travel less than 32 weeks of gestation, because they know very well that usually delivery happens at 37 weeks, right? Firstly, they need the medical certificate, right? Firstly, they need the medical certificate for their allowance of the, traveling, right? And once they're having this, and, less than 32 weeks will be allowed for boarding the flight, right? And I'm talking about the domestic flight, and I'm not talking about the very long flights. For example, the flight is there for 6 to 8 hours, right? It's not that. If the flight is for the shorter duration and it is under the domestic limits, right? The limits, the travel advisory which are given for the pregnant woman, that less than 32 weeks are allowed for the travel. Less than 32 weeks of gestation, they are allowed for travel, right? Allowed for domestic flights. Okay, from many companies, from most of the companies, right? Okay, guys. Now, if you talk about the cruise, that is less than 24 to 28 weeks. But however, next point over here, which I would like to mention, that what about the yellow fever endemic countries, right? Yellow fever endemic countries, and let me tell you, the India is free from yellow fever. So yellow fever is exotic for India. I have told you about this thing many times in my classes, that yellow fever is actually exotic for India country, because exotic means what? Exotic means the thing which is not present in the country, and it has been imported from somewhere. Because for an example, exotic drink is not made in this particular thing, particular area. Basically it has been imported, and that's why we are calling that as exotic drink, right? So that is the thing over here. So that's how the yellow fever is exotic for India, and we want to maintain this thing that yellow fever should always be exotic in India, because if the yellow fever will come, mortality rates are high. So that's the thing over here, right? And that will be the attempt from the WHO side also, that if some country is endemic of some disease, some countries the exotic for some disease, so that disease should not enter again into that country, because it takes a lot of hard work, a lot of time to battle with that disease and to eradicate that, right? So that is the reason. So yellow fever endemic countries, guys, if I talk about here, if you, for example, you want to travel to some country who is actually endemic with the yellow fever virus, right? Yellow fever. So over there you can't go like that. You should be having the medical certificate in your hand at the airport, and you should be showing it to the authorities that yes, I got the vaccine 10 days before my this travel date, right? I got the vaccine, and it's not that you just got it 1 week back, or you just got 3 or 4 days back and now you are coming for the traveling part. They will not allow you, right? Here you should be getting the vaccine for the yellow fever over here, right? In the medical certificate, it should be mentioned, the date should be mentioned that you got the virus vaccine, you got the yellow fever vaccine, and it is more than 10 days back, and then only you will be allowed to board the flight, right? Second thing, if there is a pregnant lady or if there is a pregnant female, right? In those cases, however, we should not be giving the yellow fever vaccine, but still, in any case, if she wants to travel, right? If there is some very emergency condition is present over there. So for pregnant female, if she wants to travel, in any case, like, there is an emergency situation and something like that, in that case also, however, it is not recommended to give them yellow fever vaccine, but in case if she wants to travel, there is a rule that she has to get the yellow fever vaccine, right? That is 10 days before again, right? So if she is pregnant, still she needs to get the yellow fever vaccine. However, there is no recommendation for that, but if she wants to travel to some yellow fever virus endemic country, then obviously they should be taking this, they have to take it, yellow fever vaccine before 10 days of their date of journey or before their travel, right? So I said that in the yellow fever countries, I'm saying that yellow fever card is required. Yellow fever card is required, and in that card they will be mentioning the date that at this particular date they got their vaccine done. So on that card, I mean the yellow fever vaccine, right, is actually mandatory, and the date will be mentioned on their card that on this date this particular person has been vaccinated with the yellow fever vaccine, right? Okay. Now, what about the validity? I told you multiple times that validity will be simple 10 days, right? Validity will be 10 days of vaccination for lifetime, right? Yes, once you get it, you are free from that, right? Vaccination from left, right? So after 10 days, right, more than 10 days should be there, right? So that was about the several international health agencies, and at last we have talked about the international travel regulations, right? Thank you.